I don't think that's what our founding fathers intended. I think that when they set up representative government, they expected people like you, the two of you as senators and representatives of citizens, to actually be the ones sitting at the head of the table and making those decisions. Any thoughts on that?
Oh, I think you're spot on. I mean, can you imagine if we only allowed accountants to decide tax policy or nurses to decide healthcare policy? I mean, it would be
or lawyers decide our laws. Oh, wait a minute, we do that already. Go ahead. Yeah.
Exactly. That's exactly right. So I think you hit the nail on the head. This is a representative government, and we should. We were elected to do by someone who trusts us in the job, so therefore we certainly do deserve a seat at the table, at the head of the table, mind you, as we create policy. So I definitely agree with you. That's spot on.
Yeah, our job's to listen to constituents, to listen to businesses, to listen to the needs of the community, and then respond to that. And if government's
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential. And here's your host, Jeff Crank.
Hey, welcome to another episode of American Potential. Thanks for being with us. Look, a lot of families are dealing with daycare, families that have working parents that need someone to watch over their children while they go to work, and they have a few options to pick from. Now, more and more families face the struggle of finding quality daycare for their children. Families can choose to have a family member watch their child. They could also choose to do in-home care, where the child goes to a person's house, or the person comes to the family's home. Now, the last option for families is to try and find a daycare facility. But as most parents know, daycare costs have gone up to the point that for some families, it's equivalent to another monthly housing payment. What a growing struggle for Americans' families. In addition, for some parents, it's difficult just trying to get your child into a daycare because some facilities have a very long waiting list. And it can take months or years before a spot has opened up. Now, in Kansas, there are two state senators trying to clear out government-imposed barriers to quality, accessible childcare. They're trying to get rid of some government red tape to help families and childcare providers. And I want to welcome Kansas State Senator Kristen O'Shea and Kansas State Senator Chase Blasi to the podcast. Good morning, Senator. Senator, how are you both?
Good. Great. Thanks for having us. We appreciate it.
Glad to be here.
Yeah. You great. Well, this is really an interesting topic, and it's one that, as I mentioned, more and more people, continue to have to deal with. There's more and more working families with two parents having to work, and as I mentioned, there are some that this is a cost that is equal to the price of their mortgage in many cases. So, talk about why this is an issue that each of you wanted to take on.
Right.
Sure, I'll start. I've got a 2-year-old and then one on the way. And we had an aunt that watched baby during the first year. All of a sudden, we were in need of childcare. And I thought, I'm well connected. This is going to be really easy. I'm going to find some place. And it took us a long time to find a place that even had an opening, regardless of pay, right? At some point, you're like, we're willing to pay whatever. There just wasn't any openings. And so we spent a lot of time, having neighbors help, and the baby would come with me to some meetings, and finally found a spot. But that wait list issue is huge for everyone. So I just feel like it's an issue I've been living. And that's what interested me in trying to help solve it.
Yeah, no, I appreciate it, Jeff. This is an issue that is very real for many young American families. And it just happens that we're just two young people in the legislative process who live this every day. And we have friends and family who also live the challenges of finding daycare, affordable daycare. And so my wife and I, we've been blessed with 3 wonderful kids, 2 of which are adopted. And so when we adopted our second son, we had to find daycare immediately. We didn't get the traditional 9-month waiting period for the kid to arrive. We got a call, had to go pick up our child, and we had to find daycare immediately. We both are working parents, and we called nearly a dozen places locally around us trying to get a daycare, and the waiting lists were up to 2 years. And it kind of really made me pause and think, what is the reason why is that? Why do you have to wait so long to get childcare? So having dived into the issue, Senator O'Shea and I, we really found in some ways Kansas is the big problem is because of the government. The government has put hundreds of providers out of business in the last 5 years due to burdensome regulations. And so we've been really trying to tackle that issue and really remove barriers so we can have more childcare spots open, and which will there create more slots, which would then drive down cost. I mean, Kansas, I think, is about $12,000 for one kid per year for childcare on average. And so, that is a lot, especially if you have more than one kid. The average Kansas family might as well have one parent stay home from work, and which every family's got to decide what's best for themselves. But what we ultimately don't want is the government being the problem.
Yeah. Well, what's interesting about this is what I actually love about state legislators sometimes and state legislatures is a lot of times these are problems that are brought to you by constituents, but it sounds like in your case, in each of your cases, this is something that you each deal with personally, Senator Blasi.
Yeah, just for example, we've had to wait weeks to get on. Years to get on the waiting list. And so we had to make arrangements, whether asking for a family member to help or asking for, a neighbor, which in Kansas, it's now illegal to ask anybody to watch your children that are not a family member, which is unreal to believe that. But yes, it's against the law for anybody to watch your child for more than 20 hours in a week if they're not related to you. And that's a new law that was passed just a few years ago, before we got here.
That's incredible. Senator O'Shea, any thoughts on that? I mean, this is obviously something you've taken on because it's personal, but tell me, I'm sure you've heard since you've taken this fight on, you've heard from other constituents and other people in the state of Kansas who are cheering you on and saying, hey, this is a problem we're having too.
Yeah, definitely. A good friend in a rural area of the community, she goes to a childcare, in-home childcare, and she says she's not regulated, but she doesn't care, right? She runs a good ship. She was regulated for a long time until it became just too much work for this provider to be regulated. And so, but it's interesting then when we talk about kind of this black market of childcare, right? It's way easier for people to run the business without being registered with the state. But then there's a lot of that happening and people aren't willing to say who they are because they don't want to get in trouble. So the idea of safety keeps coming up and keeps getting pushed back. And we say, well, how safe is safe? How safe is if you're bringing your kid with you to meetings and they're going over the neighbor's house that may or may not have electrical outlets plugged up, all of those different things. So you have to be reasonable. We've also heard from some of our, in my community, one of our biggest employers, a hospital that runs a very large daycare. And when they're looking at creating a director role, they could add 100 childcare slots, and they're having to wait almost 2 years for this person that has a master's degree, that has experience to get all the right qualifications to be able to help run that childcare. So a lot of it too had to do with qualifications to be able to oversee the children or run in kind of those leadership capacities at some of our larger centers.
So let me back up just a second. So you're telling me that in the state of Kansas, under this law that was there before you both came along, if I'm a neighbor or my kid's a friend of another kid and his parents want to watch me for 48 hours or 2 days or something, the government says that they can't do that?
As long as it's more than 20 hours a week, yes, the government would say that's illegal and you should not do that.
Unregulated childcare.
The government wants to know where your kids are at, who's watching your kids, and whether or not they believe it's safe.
I wonder how this ever got. I mean, maybe how this got passed. I mean, I can't imagine what legislators would vote for a law that would do that and restrict freedom of, just kind of freedom of association on this.
Well, Jeff, we ask ourselves a lot of times, how in the world did this get passed?
Yeah.
So I think it's probably one of those moments where you get a massive bill with a lot of things thrown into it. I mean, we have providers who are faced just overburdensome regulations every day. I mean, we have providers who are required in the state of Kansas to put a toothbrush in a child's mouth after every snack or every meal. And I mean, can you imagine you're watching 8 kids and you have a snack, you go put a toothbrush in every kid's mouth? I'm talking about a choking hazard, if you ask me, or
Sure.
about, germs galore, share each other's toothbrush. But it's just, it's just some things like that where you're just like, where is the common sense? I mean, what happened to common sense? Who wrote this? So, that's just a few examples of everyday struggles for childcare providers in Kansas.
Yeah. Well, and let me ask you that, and I'll start with you, Senator Blasi. What about childcare providers? I'm sure that you're hearing from them. What have they told you about some of these other regulations? I'm sure stuff like that's being rolled up into your legislation, right?
In Kansas, we have some urban centers, but we also most of our state is very rural, and so we know that since the beginning of our state's beginnings, people have pulled themselves up by the bootstraps to figure out their own solutions for their problems. And what the state has done is they've created so many regulations that have put home-based childcare, which is what has always been traditionally the childcare model for everyone. If you're not working, if your both parents are working, they usually find a neighbor or someone they know and trust, someone in the community at a home daycare-based facility. But the state of Kansas is trying to drive all those people out of business and have government centers ran every corner of the state. They want, ideally, is to take a child that is born, put them in a government child care center that's funded by the government, and then they go through the process and they get kindergarten, and they go to this local school, and they go to the school system from K to 12. So what Kansas is really trying to do is push birth through 12 education. That's what they're trying to frame it as, is early childhood education. But that's what they're really driving here. And so what they're doing is these regulations are driving hundreds of home daycare providers out of business. They can't meet the regulation requirements. It's unaffordable. And so that's what they're really trying to do. And unfortunately, it's working. And so today in Kansas, we see there's thousands of less spots for Kansas children, especially in our rural areas because of these regulations.
Wow. That's amazing. And it's really, we talk about government control, and that's a great example of it, right? Just trying to freeze them out. And we've seen it in K through 12 education, but it sounds like here, this is trying to even go down to the day you're born. Senator O'Shea, how would, I guess it's Senate Bill 282. I think I've got the bill number right. How does that help families, but also child care providers?
Yeah, there's 3 components that were really large in that. One, in Kansas, our infant to staff or childcare provider ratio is 1 to 3. So you don't make money on infants. The only reason some childcare centers have infants is because it's an automatic pipeline into the 1-year-old class. So we are one of 2 other of the strictest states on that. So we just proposed, hey, move it 1 to 4. Which goes along with about 60% of the other states. So how do we know it's safe? Because majority of the other states are doing it. So increasing that infant ratio just a little bit. Next, we allowed for if someone has a PhD or they've had a master's of special education working in schools, they then can carry that experience into the childcare arena, which before, no, you had to have worked at that child care center or had a specific child care degree. So there just wasn't a lot of flexibility in terms of the professionals that could be watching a child. If your center moved from 50 kids to 51 kids, all of a sudden the top person wasn't allowed to step into the classroom. So we don't tell schools that the principal can't substitute in a classroom, right? But that's what was happening. The last component of this bill that was pretty large was the professional development hours. So those have continued to exceed. They're up to 16 hours, and they're very prescriptive. So they have to be certain continuing ed. And we were hearing from a lot of providers that have said, I've done this class every year for the last 20 years. It's a waste of my time. I have to do this on a Saturday or take time off, right? Send kids home with their parents. So just kind of burdensome professional development where I think if we said, hey, you pick the professional development that you think is going to do the best for your company and for your profession and let them have some freedom around that.
It's amazing. I think these would make radically change this, and I'm sure there's other things you can do as well. But it sounds like you have looked at other states and what they're doing. And it seems like childcare seems to be working in many of the other 49 states in America. So how does Kansas rank? I guess I'll ask each of you, how does Kansas rank with regard to, safety in childcare facilities and things like that versus other states? I assume it's comparable.
Well, I would just say, that's what the great thing about our country is. Every state does things differently, and we learn from each other's successes and failures. And this is an issue that has been around for a long, long time. And Kansas, for some reason, the last 5 to 10 years, thought it's a great idea to place some of the strictest regulations and rules in the books, which has had a very adverse effect for our state, which has really hurt our child care industry and just options for parents. And so now looking at other states, like Senator Shea said, look, if it's so dangerous, then why is Kansas, why are other states following Kansas's lead, making even more regulation, bringing more stringent rules? Right. So that's the great thing about this nation. We're looking at other states to say, this is just crazy. What are we doing? We got to loosen these things and create more options for parents.
Right. And allow for the child care in-home or center-based child care to, they're business owners. They know what they're doing. We can trust that they're going to make good decisions about the safety of the children. We don't have to be overseeing them so tightly.
Yeah. And let me ask you, Senator O'Shea, I assume you have, and I hope you have this answer. I don't want to put you on the spot. If you don't, that's okay. Are there other states that are a lot less regulated, that are doing this right and still obviously protecting children, but giving parents the opportunity and a variety of options? Are there other states that are kind of models in this area?
We've certainly seen that there's a lot of other states that are have a lot more loose options, and you're not seeing headlines about more children deaths or anything like that. And so that's what I think is important. Is you always want safety to be number one, but you can loosen the locks a little bit and still have safety. Right.
Senator Blasi, now this bill was introduced last year, the same bill. What happened last year?
So the Senator Shea and I introduced this bill last session, mid-session, had the hearings, all the educrats and the governor, who's a Democrat here in the state of Kansas, came out saying that we do not support child safety or care about the safety of children, which is just insane since the two of us have young children. I think parents know what's best for their children, and we need to ensure parents are empowered. So we had this bill, had a hearing, it went through the legislative process, it passed the Senate, and then went over to the House passed it, and then ultimately ended up on the governor's desk. And Governor Laura Kelly vetoed that legislation, and unfortunately we were just a few votes short from an override. Again, our governor and some members on the left will not be happy until the government is raising our children from birth to 12th grade. So that's ultimately what their goal is here. They think that's the answer. So we unfortunately didn't get across the finish line last year, but we're going to continue to look at ideas and explore options of what we can do to help alleviate this crisis for parents and children.
Yeah. Now you're looking at introducing a new bill this year. Tell us some of the things this new bill would look at changing as well.
Well, so last year's bill did touch so many different things, which Senator O'Shea kind of alluded to in her earlier comments. So we're trying to maybe focus more narrow and be more focused on exactly what can we target that is just so outlandish and see what we can get done. And one of the rules is what I mentioned earlier, which is it's illegal for someone who's not your blood relative to watch your children after more than 20 hours. It just seems crazy to me. If your neighbor's retired and you're in a crisis and you can't find childcare, yet you want to go to work, and you need someone to watch your kid, and you trust your neighbor, you've known them forever, why couldn't they watch your kid for them during the week if they're willing to do it? You know your neighbor. You should be empowered to make the decision that's best for you and your family and your situation. And so what this bill will do is try to just be more focused on exactly what we target and see if we can get that across the finish line.
Yeah. Honestly, I'd trust my neighbor more than I'd trust my government when it comes to taking in my kids and watching after them. I would assume, is Americans for Prosperity helping on this bill and changing? I hope that they are.
Good.
Yeah, they absolutely are. I think they're always about trusting the business and decreasing regulation. Regulation is that barrier for the business owner. It's a barrier for the parent. You're seeing more parents say it's not worth it to try to find childcare or pay for childcare. So then they're leaving the workforce. And I think that's notable, specifically if you think in most families, it's mom. And most nurses or teachers are moms, and you're seeing them leave the workforce like crazy, and a big reason is childcare. So yeah, we ever appreciated AFP's perspective on less government regulation and helping us with these bills.
And they've been a partner, as well as numerous business groups like the Chamber of Commerce and other groups. And in fact, we have tons of providers who are also on our side helping us advocate for change, because our opponents to the bill have said, well, you two aren't providers, so what do you know? They act like, they say you don't deserve a seat at the table. We are the ones that wrote the rules. We're the bureaucrats, and we're the ones that have early childhood education degrees, so therefore we know best and we should determine the rules. And that's the mentality we've been battling here in Kansas. But as young parents and business-minded folks who own business and stuff, we deserve a seat at the table too. We know what Kansas families and Kansas businesses are struggling with right now, and that is just lack of access to childcare.
Yeah, you deserve, actually, as parents and as legislators, you deserve the seat at the head of the table, not just a seat at the table. That's that paternalistic attitude that many bureaucrats, quite frankly, have. We've seen it in K through 12 education. That, hey, we know best. We know best what's best for your kids. So, parents, don't worry about it. That's got to end, and it is ending, I think, across America in K through 12 education. But that's what you're confronting here, is somebody, just because they've been working for a government agency for 20 years, that somehow qualifies them to decide what childcare should look like in Kansas. I don't think that's what our founding fathers intended. I think that when they set up representative government, they expected people like you, the two of you as senators and representatives of the citizens, to actually be the ones sitting at the head of the table and making those decisions. Any thoughts on that?
Oh, I think you're spot on. I mean, can you imagine if we only allowed accountants to decide tax policy or nurses to decide healthcare policy? I mean, it would be
or lawyers decide our laws. Oh, wait a minute, we do that already. Yeah. Go ahead. Yeah,
exactly. No, you're exactly right. So I think you hit the nail on the head. This is a representative government, and we should. We were elected to do by someone who trusts us to do the job, and so therefore we certainly do deserve a seat at the table, at the head of the table, mind you, as we create policy. So I definitely agree with you. I think it's spot on.
Yeah, our job is to listen to constituents, to listen to businesses, to listen to the needs of the community, and then respond to that. And if government's not responding, then it's our job to push.
Yeah. It's incredible to me that somebody whose job depends on more government-sponsored daycare facilities, they're probably not the best person to be able to make that decision. It's probably someone who represents the citizens of Kansas. That's just my thought. Well, both senators, thank you both for joining us. We appreciate you and appreciate you doing the great work on this. And I hope other states look at what you're doing. This could be model legislation in other places.
Well, I appreciate your time, and thank you for allowing us the opportunity to share our story. And hopefully we can get this across the finish line.
Thank you.
Yes, thank you. Well, listen, I mean, this is such a great example. We talk about this all the time. All these government-created barriers that are put in the way of people. And, people just live their lives. These two senators, their constituents are out there just living their lives and struggling to make ends meet and make it all fit together and get their kids daycare. And the government is messing it up. And so thankfully, we have good legislators like this who are out there making a difference. Thanks for joining us. Thanks for watching and listening to this episode of the podcast. As always, contact me, Jeff@AmericanPotential.com. I'd love to hear from you. Thanks for joining us.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.